Could Omicron hasten the pandemic to endemic transition? 6th of January, 2022, the statewide COVID-19 outbreak, which included more than 1 million new infections on Monday, raises concerns about whether the more contagious Omicron form would hasten the transition from pandemic to endemic disease. Is the sharp rise in the number of people testing positive for coronavirus a sign that the US is on the verge of achieving genuine herd immunity? Experts in infectious diseases weigh in on the possibilities. An endemic eventuality. However, whether the present surge means the projected switch to endemic COVID-19 would occur sooner is extremely difficult to predict, according to Michael in Maryland, mile per hour. It's unclear whether another highly transmissible variety will emerge, he says. Lynn, a hospital epidemiologist at Rush Medical College in Chicago, believes that at this moment many more patients have had their immunity. It could be a seasonal variety, he speculates. COVID-19 being endemic is a genuine potential, but a genuine potential, according to Eleftherios Mylounakis, Maryland, chief of infectious diseases for Lifespan, which manages hospitals and clinics throughout Rhode Island. He explains, "We have a number of different viruses that don't follow the same annual cycle. The length of time that people's immune responses will last in the future is one of the unknowns." According to Saira Madad, a doctor of healthcare science and infectious disease epidemiologist at Harvard's Belfer Center for Science and International Affairs, the transition from pandemic to endemic is not a light switch, and not a light switch. Instead, we should keep focusing on lowering transmission rates and minimizing overcrowding in our hospitals, she argues. Is there a rush to herd immunity? When asked if the Omicron surge may bring the United States closer to herd immunity, Lynn responds the short answer is yes. The surprise in this scenario is that the virus has mutated enough to evade first-line immune responses, specifically antibodies, he explains. That is why, even in highly vaccinated communities, we are witnessing outbreaks. Mylounakis was less convinced about herd immunity. With a fast-changing virus, the concept of herd immunity is really difficult to address, he explains. One explanation, according to Mylounakis, is the large number of unknown variables. He believes that as the Omicron spike subsides, a clearer picture will emerge. In addition, because there are so many persons afflicted with the Omicron variety, immune protection should be at its highest. He claims that the vast majority of the population will be exposed and will develop some level of immunity. Madad concurred. Vaccinations have grown as a result of the Omicron surge. This, together with the influx of new patients who will have natural infection immunity, will help us move closer to herd immunity. Immunity against disease vaccination is the safest choice, and over 1 million doses of the COVID-19 vaccine are already being administered to soldiers every day, Madad explains. A shorter, more intense surge? The United Kingdom's COVID-19 experience has often been used as a predictor of what would happen in the United States. According to Mylounakis, if this trend continues with Omicron, the peak should last roughly 4 weeks. To put it another way, the Omicron era may pass more quickly than the Delta era. Furthermore, some research suggests that antibodies created by Omicron infection remain effective against the Delta form throughout time, limiting the chance of Delta reinfection. The present uptick in activity could mean better protection in the future. We'll end up with more immunity as we attempt to get to the other side of this Omicron wave, Madad says. We'll end up with more immunity as we attempt to get to the other side of this Omicron wave.